Hello, everybody. It's Steve Katsikaris, Norland, Coboconk, Minden Community Watchdog. Just putting a video up here for you today. This is the health unit of the Kawartha Lakes in Haliburton here. Dr. Natalie Bocking. I noticed her video was put up on the health unit's website there on YouTube, but the comments were turned off. But I thought we'd go through this together and let's hear what she has to say. I haven't gone through this video yet, so I'm just going to go through it with you. And don't forget to thumbs up or down on this video, and please leave a comment on what you think is going on with the COVID-19 issue here in our community. All right, so let's see what she's
Okay,
got to
great.
say.
Thank you. It's wonderful to meet everybody virtually. I stepped into this position as the new medical officer of health 3 weeks ago, and it has been a bit of a whirlwind. My apologies that we weren't able to connect over the last 2 weeks, as I know quite a lot has happened with regards to COVID, and there's certainly lots of things to update you on. As you can imagine, my calendar has been quite full, and really making sure that I'm fully up to speed on everything. I guess since this is the first time that we've met, I was just going to spend a couple of minutes telling you a little bit about myself, just so you know how I came into the position, where I'm from. So to start with, I'm a public health physician, trained in public health and preventive medicine. I've always been passionate about public health. I worked briefly in community health and public health before going into medicine, and then throughout my training in medicine had an interest in public health. And I think one of the things that has always drawn me to public health is really the community focus and the population focus. I think things that I really do enjoy and value in this type of work is the partnerships and relationships that I think as organizations we create to work with people where they're at in trying to improve their health. So it was quite, I was quite excited when an opportunity arose in this region. Prior to this, I had been working in northwestern Ontario, so was living in Sioux Lookout. I was seconded from Thunder Bay District Health Unit to work and support full-time Sioux Lookout First Nations Health Authority, which is a First Nation government organization supporting 31 rural and remote First Nations communities in northwestern Ontario. So I was there for about 4 years, and then my husband, who grew up in the city of Kawartha Lakes region, had decided to take over his parents' farm. So we relocated down to city of Kawartha Lakes area, and he started to farm full time.
Vanessa Murphy.
And
he is now joining.
I continued to support Sioux Lookout First Nations Health Authority and Anishinaabe Nation remotely for about 4 or 5 months. And at the beginning of the pandemic, I was with them supporting for the first 4 months of the pandemic, and then took a leave to have the birth of our second child. So between last July and until 3 weeks ago, I had been at home looking after our now 8-month-old. So time has flown by. So I think it's quite fortunate to be able to find that a position opened up where I'm living to be able to do the work that I was trained to do, and I'm quite passionate about. So I think it has been quite fortuitous. It's of course it's challenging to take on a position such as this mid-pandemic. But I had heard before, and I have now seen it kind of working up close, is how strong the team is at HKPR District Health Unit. So I think, yes, the one of the leadership roles has changed over, but all of that work and the background work that has happened is continuing to happen on a daily basis. And really, I've hit the ground running, if not sprinting.
How about
So,
drinking?
so that's a little bit about me. I'm looking forward to this session. I think that the media, that you have a really important role to play, especially in this pandemic, in terms of sharing information with our residents and
Yes.
community members, especially
Yes. Who
at
are the people
times
that
where
died?
people are either
Names, medical
frustrated
records,
or worried.
please.
They're concerned about their health, their loved ones' health. So I do appreciate the opportunity to speak with you today. So I'm going to focus my update on first on the epidemiology, what we've been seeing in terms of COVID-19 activity across our jurisdiction in the last couple of weeks. And then I'll provide an update around vaccination rollout. And then there'll be an
Did you get
opportunity
yours?
for questions after that. So with regards to what we're seeing in terms of virus activity, so to date, we've seen 1,534 cases of COVID-19 in our jurisdiction. So HKPR District Health
Cases.
Unit, as you know, has 3 main geographical regions: Northumberland County, City of Kawartha Lakes, and Haliburton
How many
County.
deaths?
So that total number is across all 3 regions. In the last 14 days, we've been notified of 291 new cases. So
How many
that was
deaths?
a fairly
No
significant
deaths?
increase from what we had
There you
been
go,
seeing
folks.
earlier, or at least more
No
recently in the
deaths.
pandemic. Currently, there is 124 active cases of COVID-19 across our whole jurisdiction, with 8 in Haliburton, 35 in the City of Kawartha Lakes, and 81 in Northumberland. A
But
couple
no
of
deaths. That's great.
comments about what we're seeing in terms of the data. So we know that in the last of the cases we've been notified in the last 2 weeks, approximately 13 to 14% of those have been found to be the variants of concern. So have the mutation that
Starship
demonstrates
Enterprise calling you.
a variant of concern. Now that number,
Who's
certainly
this guy? Dr.
across
Evil.
the province, the percent of cases that have been identified as variants of concern has plateaued at around 69% of new cases. So we are not seeing in our region the same proportion of variants of concern, but we are seeing it. There is a delay
Variants
in
of
reporting
concern.
from the laboratory if a sample has the mutation consistent with variants of concern. So our numbers will continue to change. A question that I'm often asked related to that is which variant is it? And the way that the laboratory process works
Yeah, the
with
deadly
this
one.
is that
That's the
they'll
one we
do an
want to know
initial
about.
screen to check for specific mutations. If those mutations are present, then we know it's a variant of concern. In order to
A variant
find
of
out which
concern.
variant it is, they have to go and they have to sequence the
Another
entire
starship calling you.
virus to
That's
determine,
defiant.
is this the UK variant? Is it South Africa variant? Is it Brazil variant? And that
Holy
whole genome
jeez.
sequencing can take 1 to 2 weeks. Plus, they're not
Man.
doing it on every sample due to capacity issues at the lab. We do know that the majority of variants that have been identified in our region have been the UK variant. And if we are seeing any
Well, of course, we're a
changes
British
with
colony.
that, then we'll be sharing that
Has
information
royal
if it
assent.
becomes, or when it becomes available. The other piece of information I'd like to share related to the cases that we've identified in the last 2 weeks is that 30% of those cases have been under the age of 20. So whereas at the beginning days of the pandemic, we were seeing
Sounds like the flu.
the majority of cases among the older population, and
No
now
deaths though, right?
we are seeing it among younger population. This could be a
Cases
feature
of
of
the
2 things.
common
So
flu.
one, we've been able to vaccinate certainly the higher risk older population, and 2, some of the variants that we're seeing have been reported to cause infections in younger populations. So not necessarily children, but younger population overall. To
Boy,
give
she
you a
doesn't say
sense,
too
so I
much, eh?
mentioned before that we had seen a significant increase in the number of cases. One way
Cases
that we look at
again.
this is the
No
rate
deaths.
for population over the last 7
Everybody's
days.
surviving. This is
And this
great.
is one of the indicators that would tell us what color we're
No
in if
respirators
the whole
either. What happened
province
to
wasn't in a
respirators?
shutdown. So over the last couple of days, or
How
last
many
week
people on
really,
respirators?
our
Yeah.
crude rate per 100,000 people has ranged from between 65 to 88 or 89 cases per 100,000 population. If we weren't in a provincial shutdown.
Okay, Dr. Natalie Bocking. Unbelievable. We've gone through that for about 9.5 minutes now. Holy cow. She didn't say anything. Never mentioned deaths once. All these new cases. Sounds like the common flu. I guess the new variant is going from 2020 flu to 2021 flu. But you can see no one's died. Anyways, we're going to go over to part two here. You'll see part two if you like. But maybe she'll say something in part two. But you can see this is like unbelievable. I like how they set it up at the Pine Ridge Health Unit there, or at the Pine Ridge Health Unit, whatever the heck they're called. And that guy that calls them up on the screen there, like Starship Enterprise calling, doesn't say a thing. But anyways, wait for part two. All right.